Actually, the objectives of this session for 1 hour mainly how we can arrive at an Ayurvedic diagnosis of a skin disease and how we can select appropriate internal drugs in every cases, and how we can arrive or how we can frame the external therapy in each cases, and how we can bridge the gap between the theory and practice existing in Ayurvedic dermatology, and what are the diets that can be suggested, and what are the effective drugs that can be used in Ayurvedic dermatology, and what are the Rasayana drugs also. These are the prime areas that we are concentrating along this section. So first of all, we have to reach at a particular diagnosis, Ayurvedic diagnosis. You see, there are so many terminologies, means terms existing in Ayurveda, discretely distributed in various parts of our classics, from Kushta, Visarpa, Kshudrayoga, Dushtavrana, Vadarekta. These are all the pragaranas which contain the cutaneous manifestations. There we can see various terminologies also. Various terminologies means the Ayurvedic terms which indicate the significance or significant features or morphological features of a particular cutaneous manifestation. Another form, they are diagnostic tools also. So, is it important to identify the terminology of the presenting complaint before us? You think a skin case came to your OPD, and whether you have to diagnose, whether you have to identify the exact term for the skin condition. That is one relevant question. Next one, whether it is relevant to identify the dosha dusha involvement in that particular case. You see, in while considering the terminology, there is no exact equated treatment principle detailed in treatment parts. Chikitsa Prakarana, we cannot see the exact appropriate treatment for each and every. For you see, for example, you see Vijarchika, Sagandu Pidigashya Lasigadya Vijarchika. So like that, so many morphological explanations are there in Nidana Prakarana. But exactly, this is the treatment for Vijarchika, this is the treatment for Sidma, this is the treatment for Dadru. Like that, the treatment methodologies are not described in Chikitsa Prakarana. So that is the terminology is not that much relevant while considering the diagnosis. You see, dosha dusha involvement also, while describing the dosha dusha prakarana, dosha dusha involvement in each term, each and every skin disease, we can see this is Vada Vitta predominant, this is Kapha Vitta predominant, this is Vada Kapha predominant, like that. The descriptions also is there. But while we go for treatment, for example, you see, if a Vadika Kushta with the features of dry lesion with pain and Shyava Varna, if we try a Taila Prayoga over that, externally or internally, the chances of aggravation is very, very high. Next day or next week, that the eczema will become a weeping eczema. Dry eczema will become a weeping eczema. So like that, the dosha dusha involvement directly not gives us the suggestion for treatment. In some cases, you see, investigations are also relevant. But in every cases, investigations are not that much relevant. For example, in case of repeated carbuncles or repeated nodules or repeated pustular lesions, it is necessary to investigate for the diabetic diabetic, and if that patient is diabetic, that may be diabetic related pustules or diabetic related carbuncle, like that. So it is necessary to treat primary disease, primary systemic disease, to subside the external manifestations. So in some cases, the investigations are very relevant. So you see, so every external manifestation coming to your OP, that manifestation is a presentation of a large internal phenomena that happened inside the body. Like an iceberg, this external symptom, whether that may be psoriasis or external this eczema or lichen planus, the external morphology is a simple signal of that disease. Actually, the whole disease lies inside the body as a whole, the big internal events, as an expression of that events. The external morphology happens outside the body. So it is necessary to infer, or we have to do an anumana pramana while seeing the external morphology. Yatra yatra dhuma tatra tatra vanni, that is the basic principle detailed in Ayurveda. Like that, where there is an external presentation, we have to identify that the internal samprapti, internal pathology, large internal pathology inside the body is there. So we have to identify that internal pathology, and we have to reverse that internal pathology in order to subside the external manifestation. For that, you have to go back to the basic principles of Ayurveda, that there are 6 steps in pathogenesis. As you know, from the Sanjaya stage, that leads to Prakopa state and Prasada state, Sthana Samsara is there, Vyakti and Bheda is there. So in order to reverse the pathology, in order to give a Shuddha Chikitsa, it is necessary to identify the patient in terms of the Shatkriya Kala. So we have to identify the diagnostic tools should be identified according to the sthanas, the Shatkriya Kala of the disease. So you see, events in Samprapti, in each disease, that may be cutaneous manifestation or disease affecting the musculoskeletal system, like so. There will be essentially some essential events happen inside the body as a stepwise evolution of that Samprapti. So basically, there will be a Pratilomada in his koshta. In patient's koshta, there will be a Pratilomada, and simultaneous formation of Ama will be there, and Agnimandya will be there. And as a parallel to the basic steps, there will be Doshagopa, and Dhatushti will be there, and Sododushti will be there, Krimi Janma may be there, and Ojanasha also may be there. So these are the essential events happening inside the body in order to produce a Samprapti inside the body. So you see, as per Ayurvedic principles, we are approaching the patients in a holistic way, while modern physicians are approaching the patients in a reductionist way. That means if a lesion is there, they are treating to that particular lesion. For example, if there is a brain tumor, they will remove that brain tumor by surgery. But in Ayurvedic way, if we are thinking that brain tumor is not developed due to the only due to the disturbance at the level of brain, that manifestation is due to the all internal disturbance of the body. That is the dosha level, dhatu level, sodo level. There will be some disturbances. So, in order to identify the holistic view, we have to view the patient in a holistic way. Otherwise, if we treat that patient, if we treat remove that brain tumor by surgery, that internal physiological derangement happened inside the body to produce that brain tumor remains there. So that internal disturbance will alter, and that will create another disease inside the body. So that patient may have some disease at the level of pranavasrodas or rectavasrodas, like that. Some disease may recur again and again. So in holistic way, if we are approaching the patient, we are treating the patient by reversing the samprapti of the patient. In order to reverse the samprapti, we have to identify the samprapti in each level. Samprapti assessment is the diagnostic principle in Ayurveda, not the terminology or not the dosha-dusha involvement or not the investigation only. We have to identify the patient in terms of his samprapti. Then only, you see, the systematic diagnosis in Ayurvedic way happens by assessing the patient in terms of samprapti. Pradulomata will be there, Ama will be there, Agnimandi will be there, Dosha Vruddhi will be there, Dhadu Vaishamya, Sododu. These are the essential events happened inside the body. So if we apply an ointment or if we give an internal medicine to subside the Dosha Dushya aggravation or Sododushti, like if we give a Rakta Prasadana drug, like that, that treatment only will subside some symptoms only. And as per Ayurveda, if we have to treat the patient scientifically, we have to identify the patient in terms of the some whole samprapti happened inside the body. The examples I will detail, then you will be getting the proper idea about the diagnostic aspect. You see, the pratulomata is the basic factor. First of all, I will detail the diagnostic principles in Ayurveda. Pratulomata means the Viloma Gadi of Vayu from the level of Kosta to the Shakha. So the Pratuloma Gadi can be identified by the particular features. You see, Pratulomata is not only the gastric belching or constipation. We can identify the Pratulomata inside the body by assessing the patient in terms of upper respiratory allergies, headache, heaviness in chest, cough, stomachache. These are the essential signs and the symptoms commonly patients are complaining. If we have to assess the Pratulomata, we have to ask these questions. Then we can identify if the patient is having some Pratulomata. For example, I will detail. In a patient with a chronic acne vulgaris, without healing with the common Togroga Pragarana, we detailed Chikitsa Aushadas. Commonly, we are giving Nimbali Gashaya, Tikta Gashaya, Mahamanjishtari Gashaya, Manjishtari Gashaya, Guluchari, like that. So many details, so many medicines are described in Ayurveda. So, how we have to identify the drug suitable for that samprapti is very, very relevant. So, in some patient with the chronic acne vulgaris, I have noticed the status of Pratulomata. They are having much Pratulomata. They are having these symptoms. The upper respiratory allergies will be there, headache will be there, heaviness in chest will be there. Like that, if they have the symptoms of Pratulomata inside their body, there will be no use with the Nimbadi Kashaya or Manjishtari Kashaya or like that, Guluchari Kashaya, like that. We have to give a strong anilomana drug to pacify the Pratulomata inside their body. So in diagnosing a case with a skin disease who are having the status of Pratulomata in high level, it is very relevant to ask these questions and to identify them in terms of Pratulomata. Then initially, as a baseline treatment, we have to provide them proper anilomana drugs. For example, we are giving Chirivadi Kashaya or Abhya Churna, Tripaladi Churna, like that. They are giving a proper anilomana to the patient, and they are Klayada Hara also. Klayada Haratva is very relevant in dealing these cases. So the in diagnostic aspects, Pratulomata is very relevant in so many cases. So during this session, I am trying to concentrate upon very relevant factors only while dealing with the Ayurvedic dermatology. This is very relevant factor. Then you see the amatva or samatva inside the body should be properly assessed before we are giving treatment. So abdominal fullness may be there, raised body temperature is a very relevant factor, and the heaviness of body will be there, acid belching will be there, small whole smell will be the anorexia. These are the costa level samatva lakshanas. And dhatu linata lakshanas also are there. I will detail that. You see, the if the body temperature is somewhat little raised, then there will be the chance of samatva. Along with that, the ama lakshanas also will be there. So in in those patients, while dealing with the medicines, it is very relevant to give the pajana drugs. Pajana drugs means the drugs which can pacify the amatva inside the body. So initially we have to give them pajana drugs, that is drugs or the chances of the drug choices and all I will detail later. You see, the samatva should be identified. And dhatu linata also, dhatu linata means the in all the cutaneous manifestations you see, in all the cutaneous manifestations, the chances of a stagnated ama at the level of rasadhatu or raktadhatu is there. At the level of raktadhatu or rasadhatu or mamsadhatu or medodhatu, the chances of stagnation or latency of amatva is there. So that also should be dealt very clearly. Otherwise, the chances of recurrence is very high. We will give medicines to subside the symptoms, and the symptoms may be alleviating by the medicines. But after 2 or 3 weeks or after 1 or 2 months, the patient recurs. Why? The patient comes back because the dhatu lina ama is not completely reversed. There remains there. So that will again trigger the case, and that will trigger the morphological features, and that will aggravate the condition. So it is very important to deal the case at the level of amatva. We have to give proper pajana drugs initially, as a baseline treatment initially for every patient. The duration of medicines may vary. We have to, some patients we have to give anti drugs for 2 or 3 weeks. Then in some patients, morning dose of anti drug is only necessary. Morning we are giving anti drug, evening we can give pajana drug. Like that we can frame the treatment. That treatment details I will detail later. Then you see, these are the case of pemphigus vulgaris. In these cases, the samatva ama stagnant at the level of costa and dhatu, very relevant. So in these cases, if we give a drug which are described in Charmaroga Prakarana, like Kushtaroga Prakarana or Visarpa Prakarana, directly if we are giving the drug, that will aggravate the case. Before giving a, for example, you see, in case of Kushta Chikitsa, you can see Kushtinam Snehavanena Purvam Samyag Uvajaret. Kushtinam Snehavanena Purvam Samyag Uvajaret. So initially we have to give Snehavana in patient with Kushtaroga. Then if we give a Snehavana without dealing with a patient at the level of ama or Pradhiramada, the chances of aggravation is very high. So we have to do proper pajana and anulomana at the level of costa or dhadu initially. After that only we can give the Snehavana and all. So in these cases we are giving the Samattva, Sama Pitta or Sama Kabha will be there, Sama Vada may be there. So in order to deal these cases, we are giving pajana drugs initially, Shadanga Kashaya or Dhadulina Amavajana drugs, like that we are giving for 2 or 3 weeks. Then only we can move for the other drugs. The in cases of the Daruna, as you see, these are very common cases. Daruna case, In case of Darunaga, you can you should identify the presence of kleda at the level of tok. Tok, the kleda is the very relevant factor in these cases. For kledatva at the level of the tok, there will be so many basic reasons inside the body. Commonly in children, there will be absorptive disorders. As a result of this absorptive disorders, kleda accumulates at the level of this tok, and that presents as a darunaga. In some cases that may present as a darunaga, in some cases that may present as a sigmagushta or like that. So basically you see absorptive disorders should be corrected at the level of costa. Then only we will be dealing that patient to give a Shuddha Chikitsa. We have to reverse the basic samprapti. Otherwise, we will give some oils that can over the hair oil to remove that kleda, and after 2 or 3 weeks, the patient comes back and he is having that complaint again. After 2 or 3 months, he will come again like that. The recurrence can be managed only if we address the basic pathology of the patient. By that, we are trying to reverse the pathology from the level of costa. We are doing anudomana, we are giving amavajana, we are giving a dhatu, this Agni-dipti, drugs like that. So by that itself, even not necessarily important to deal with the dosha or dhatu itself. Basically, we have to deal with the costa level and this ama level. You see, in all the cases of psoriasis, it is very relevant to identify the amatva at the level of rakta dhatu. As I told earlier, in all the cutaneous manifestations, the stagnancy of ama at the level of rasa and rakta are very relevant. Especially in the case of this psoriasis, amatva at the level of rakta is very relevant. So the rakta pajana drugs are very relevant. That drugs I will detail later. The rakta pajana is very relevant. Otherwise, if we give amrudottaram kashayam or shaddaranam guliga or shaddaranam churna, that will do a amapajana at the level of costa. Some level that will extend up to the level of rasa or rakta like that. But specifically that patient needs amapajana at the level of rakta. In case of urticaria, you see, urticaria, the Rasagada Amatva is very relevant. Rasagada Ama. The relevance of Rasagada Ama is that will be evanescent lesions. Evanescent lesion means once the lesions manifested, after 1 or 2 hours, that will subside and there will be a normal skin. And again, by triggering factors, that will aggravate and that will create a fresh morphology. Like that, the wheals, appearance of wheals. These are the evanescent lesions, especially the urticaria. In these cases, other than the if we give these acute cases, we can treat with simple drugs. If we can give a antihistaminic drugs, that will subside 2 or 3 weeks. If that is a chronic disease for 6 months or 1 year or 2 years, that there will be some stagnant ama at the level of rasa. So we have to give rasa gada ama pajana drugs to reduce this type of urticaria. We have to identify the amatva at the level of rasa. You see, these are very common descriptions we can see in Charaka and all. So the Vadika and Paitika and Kavaja skin manifestations can be identified, these morphological features. Shavarana, Khara, these are the Sobhavas or the specific features of each and every skin diseases that you may be knowing all the details very well. Just to reminding. You see, the diagnostic considerations extends to Gada dosha also. Diagnostic consideration. You see, a Gata dosha concept comes in Ayurveda reference. You see, Tojis Pudana Rukshate means the Vada dislodged at the level of skin from the costa. If the Vada dislodged to the skin or that will be manifested as Toji Spudana Rukshade. There will be cracked foot, cracked skin as a result of the dislodgement of Vada from the costa and a lodgement at the level of the skin. Basically, you see, there happens two pathologies. One pathology, dislodgement of Vada from the costa, and second pathology, lodgement of the dislodged Vada at the level of Tok. Why that happens, you see, the Vada dislodges from the costa due to the reasons. Reasons means that there will be some Pradilomakara reasons, Nidana. Pradilomakara Nidana. And the Sroto Vaigunya is there at the level of this plantar region. That is why the dislodged Vada lodges at the level of plantar region itself. You see, there are two pathologies. So we have to identify the Pradilomakara Nidanas at the level of costa and Sroto Vaigunyakara Nidanas at the level of this plantar region. I think you are getting me. Then the Sroto Vaigunyakara Nidanas may be the contact with some type of irritant factors. Irritant factors means some mud factor. Mud will be there. Some dust will be there. They are creating a triggering factor, and that causes the Vaigunya at the level of plantar region. So we will tell this is a hello. Am I audible? Any disturbance is there?
No, sir, you are audible.
Okay. Then let me continue then. Okay. Then the Sroto Vaigunyakara bhavas are the irritant factors. So we will tell that this is an irritant dermatitis or hyperkeratitis, and we will deal the region. And that topically we will give some ointment and all, and that may subside the symptomatic problems, but the chance of recurrence is more and more. Why that happens? Because the anuloma, the pradiloma vada is not reversed properly. We are not dealt with that factor. We are not addressed that factor. We have not addressed that factor properly. So we have to identify the Gatadosha concept in diagnosis. Initially I am dealing with the concept of the diagnostic considerations that are to be incorporated with the Ayurvedic dermatology for the better diagnosis. Otherwise, we will deal with the case as a symptomatic relief, and we will give some symptomatic medicines only. So we have to give some anulomakara drugs internally, and externally we have to give Sroto Shuddhikara, Rakta Prasadana or Tok Prasadana drug, Lebana or other drugs externally also. See, Dhadugata Kushta concept means there are in Kushta Prakarana itself we can see the Mamsagada Kushta. In Mamsagada Kushta, you can see the Pani Pada Spoda. This is a palmoplantar pustular psoriasis. In palmoplantar pustular psoriasis, if we treat with the patient with various drugs detailed in Ayurveda, there will be some symptomatic relief only. If we have to deal that patient with the if we have to reverse the pathology completely, we have to identify the Dhadugatatva of the Kushta, and we have to identify the drugs detailed in the Prakaranas. Mamsagata Kushta is there, Medogata Kushta is there. Like that, we have to identify the case, and I have identified the appropriate drugs for that. Dhadu Vaishamya we should identify. Dhadu Vaishamya, Dhadu Vruddhikara Lakshanas are there, Dhadu Kshayakara Lakshanas are there, Kshaya Lakshana. These the Lakshanas we should identify to identify the involvement of Dhadu also. So the usually Rasa, Rakta and Mamsa are involved, and you should identify the associated symptoms. Associated symptoms means if Rasadhadu involvement is there, Rasavaha Srodhas is involved, then other symptoms, Rasavaha Srodha Dushti Lakshnas, Asadha Ariji Rasti Verisima, Arasana, like that, Pandutam Srodha, Clibim Sadasudha, like that, other associated symptoms also will be there in those patients. So that also we have to identify. In various cases, in all the other cases also, you can see the involvement of Krimi. Invariably there will be some role of Krimi in various skin diseases, especially in case of children. Commonly we will miss that factor. We will miss that factor, and we will give some other medicines. We will not identify the Krimi. So while we are describing the basic principles of treatment, then we can see evo anyanabi roga doshan the chikitsayil nidana parivarjana chikitsa evam anyanabi rogan Swanidana Vibiri Chigilsed, Anubanthe to Sati, Chilsamanyam Prayojed, Eva Manyanavi Yogan, Swanidana Vibiri Chilsed. So, Swanidana Vibiria is the identification of Nidana, how this disease happened. Basically, in children, every cutaneous manifestation will be having the role of the influence of Krimi inside his costa. So, if we treat that Krimi with the treatment principles of Krimi, you see, the Prakriti Vighada is a very, very important concept. That patient should take the food items that will reduce the proliferation of Krimi inside his costa. He should avoid the sweet items and the pishtana, like that, the Krimi Nidana, he should avoid, and he should consume. He should take a habit of taking the tikta shagas and like that. So Krimi should be removed properly. Then the manifestations of the skin manifestation will automatically reduce. So in diagnostic considerations, the role of Krimi also very relevant. So this is an example. In Tinea alba, we are we will apply some ointment over that face. So basically, these children will be having the role of Krimi inside his costa, the Vidanga Krishnadi Kashaya or Nirgundyadi Kashaya, like that. We have to give him, and along with that, we have to apply some antifungal creams over the face. Otherwise, the disease will recur again and again. You see, Krimi Janma. This is a Bahi Krimi. Bahi Krimi. In Bahi Krimi Prakarana, we can see the role of Mala. Bahi Malaja Krimi. That the Mala is actually the Mala accumulates over the skin because the sweat coming out of the skin is not completely purified. That sweat contains unpurified elements inside that sweat. So that accumulates in specialized, that a particular portion of that skin which is having a moisture content. So that undergarments will be having mala, and that undergarments will not be able to absorb the sweat coming out of the skin. So that uncompletely decomposed sweat, the elements of that sweat will precipitate over that area, and the proper atmosphere to proliferate that fungus is there. So that fungus fungal infection happens there, and the patient will be having the fungal eruptions all over the body, and that spreads also. So initially we have to identify the nidana, then only we can identify the samprapti. So the alleviation from the nidana, reversal of the samprapti, all will create the antifungal effect there, and we have to we have to give some drugs which can demoisturize that area. These are all the diagnostic considerations only. You see the spreading of that tinea. Tinea versicolor also. In tinea versicolor also, the concept is very relevant. Internally, we have to give criminal the treatment for krimi. The concept of dushi visha is very relevant. Concept of dushi visha, because the dushi visha is the factor which can aggravate, which can some triggering factors can aggravate the dushi visha. Like that in lichen planus disease, lichen planus, you see even after subsiding the symptoms, the chances of aggravation is there in presence of triggering factors. So these triggering factors will aggravate the condition, like that, like the in lichen planus. So we have to identify the case in with respect to dushi visha, and we have to take the drugs detailed in dushi visha prakarana to deal with the lichen planus. You see, while discussing the diagnostic considerations in cutaneous manifestations, the role of sattva is very relevant. Sattva means the manasika bhavas inside the body. So the manasika bhavas will trigger, or that will cause some cutaneous manifestation. This is a case of prurigo nodularis. Prurigo nodularis is a psychodermatological condition. Psychodermatological condition means the dermatological condition that is created, not triggered, but that is created or triggered by some psychological reasons. Essentially, there will be some this dosha dushti, the sroto vaigunya, all will be there. But the manasika bhavas are the strong triggering factors in these cases. So like that, as previously described, this is a contact dermatitis. That contact, the undergarments contact is there. So that contact created that particular condition. So nidana parivarjana also very relevant while we are discussing the diagnostic considerations. So these factors, concisely, I am concluding the diagnostic consideration part. You see the pradilomata, ama, sama, dosha buddhi, gada dosha concept, dhadu dushti, sroto vaigunya concept, krimi, sattva, dushi visha, nida. These are all the very relevant factors while we deal with the diagnosis of a skin condition. Otherwise, if we give a symptomatic treatment for a condition, the chances of recurrence is there. So we have to identify the patients in terms of these factors, and we have to give appropriate drugs to reverse these conditions. Then you see, these are the examples of drugs utilized. Padavali Muladi Kashaya or Padavali Muladi Churna is the first choice in all the conditions, all the chronic conditions, because Sramsana treatment is the baseline treatment in all cutaneous manifestations, because Sramsana is the Paktavyam eda abhaktoiva srishtam koshte maladikam. Essentially, there will be some ama inside the body, and that ama should be eliminated from the body initially, and the remaining ama should be digested, or that should be given for pajana. The remaining ama should be digested with the pajana aushadhas. For that, we are giving some pajana aushadhas. Initially, we are giving samsana, and after that, the rasa pajana drug, rasa gada ama pajana drugs, kalingagam padolasya patram kadugurohini. These are the drugs detailed in Vishamajura Prakarana of Jura Chikilsa, Vishamajura Chikilsa, rasa gada ama chikilsa, rekta gada ama chikilsa, mamsa gada ama chikilsa. Like that, the dhadu gada ama chikilsa is detailed. So we can select Kalingagadi or Padora Shariba Musta Bada Gadugirohini, or more or less same Padola Gadroginyadi Kashaya. While we are giving a Lenkana or Samsana or Pajana drugs, patient may be having Shoshana inside the body. Vada with the aggravation may be there. So, in order to pacify the Vada with the aggravation, we are giving Drakshadi Kashaya. And after that, we are giving a Agni Devana drugs like Guruchadi Kashaya. And after giving the Agni Devana drugs, before giving a Snehabana, we are giving very, very specific drugs. Specific drugs means if there is a Vada Rakta involvement, we will give Manjishtali Kashaya. And if there is a multi-system involvement, we will give Mahamajishtali Kashaya. And if that is a nodular lesion, we will give Nimbadi Kashaya. And if that is having a severe itching or Visarpa Subhava or this articarial fashion, and then we will give Amrita Rajanyadi or Amrita Vrishabhatoradi, like that. Rekta Prasadana drugs, Shonidamrita is a Rekta Prasadana drug, like that. So Tiktam and Mahadiktam are the Tiktam Kashaya we are giving as a alleviating drugs to pacify the Tishna Ushna Subhava of Pitta. And Mahadiktam Kashaya contains the Amalagi as the main bulk of the combination. So Amalagi is a main bulk of that combination, means that is a very good Rasayana drug. So Mahadikta we are selecting at that point. So you see, these are the scientific criteria for selecting drugs in Ayurvedic dermatology. Other than this criteria, if we are selecting blind drugs means sometimes we will select a Manjitari, sometimes Nimbadi, sometimes Guruchari. If that is effective, then we will go with that. Like that, we are treating the patient in many cases. It should not be there. We are very, very scientific peoples, and we have to identify the patient in scientific way, and we have to connect the diagnostic principles with the treatment principles. And like that, if you are moving with the scientific backgrounds, then we can treat the patient in a scientific manner. You see, these are the basic principles behind the selection of drugs. Hello?
Yes, sir, you are audible, sir.
Sir, any time limit is there?
No, you can proceed, sir.
Sir, any time?
No.
Okay. Then I am going with topical therapy. Topical therapy means external therapy. This is also very, very relevant. While dealing with the internal systemic therapy, I have mentioned all the details of the internal medicines and all, the scientific reasons behind the selection of drugs. If we deal these patients with a scientific approach, then also the chances of external application causing ill effect is there, because some external medicines will trigger the internal pathology. So this is a case of the eczema aggravated due to an external application. You see, this anterior plantar region, there was a hyperpigmented lesion over that, only a hyperpigmented lesion over that area. When I applied a Rasottamadi leva, after 3 days, the patient came back with this lesion, weeping eczema. That was a dry eczema initially. It became a weeping eczema, and this is a psoriasis case. Actually, this was the patient was having a hyperpigmentation at the level of plantar region. He was having a severe itching over that area. So I thought there will be he will be having relief with a prachana, and I have done a incision over that hyperpigmented area with itching. So next week the patient came with a whole body extended psoriasis. So you see, these are two typical cases of angry back syndrome and Koebner's phenomena. Angry back syndrome is and Coburner phenomenon. Angry back syndrome is a particular immunopathology happening in some patients with the eczema. If we apply an irritant ointment or irritant labana over an area, the chances of aggravation is there. In Coburner phenomena, if the patient is having a pathology of psoriasis, lichen planus, or vitiligo, then if we do an incision over his body, or if he got an injury over an area, the chances of aggravation is there. So you see, this is the statement from an allopathic hospital, history of treatment with Ayurvedic medication. Commonly we are seeing these types of discharge summaries. Ayurvedic medication will aggravate the skin condition. People also have the notion that Ayurvedic external medication or internal medication will aggravate the lesion. So actually this is due to this contra to this principle. You see, iti doshe vijite anta tokste shamanam bahi pralevade hitam tikshna aleva utkrishtam kushtam hi vivrdhimedi marine dehe. If we apply an irritant ointment in a body which is impurified, not purified properly, if we apply an irritant ointment, the chances of aggravation is there. So we have to identify the cases and we have to purify the body internally. Then only we can apply an irritant ointment. Before giving an irritant ointment, we have to identify the patient if he is purified internally or not. There are some basic principles behind that. You see, in acute cases, we should use some Shira Kashayas or Shira Kashayas or the Takra Kalpanas or Ghee Kalpanas, Shatadodgrada, etc. We should avoid this Gomutra preparation style or heat or shara like that. These are irritant applications. So initially, if we apply these ointments or Gomutra or Taila, the chances of aggravation is there. So before purifying the body, we can give some Shira Kashayas or Shira Kashayas for giving symptomatic relief. In subacute pathology, means the case with a duration of 3 to 4 months, 3 to 6 months. In these cases, you see, formation of lymphocytic infiltrate is there, starting to lose the permeability of membranes, and the acanthosis, the histological change is acanthosis. So you see, the permeability is starting to lose. So in these cases, we have to help the elimination and we have to activate the circulation. For that we have to give warm kashayas and warm Shira Kashayas or Dhanya Amla or ghee preparations like that. We have to avoid cold applications. The cold Shida Stambhane. Shida will do a stagnation at the level. So cold application should be avoided and warm applications are very suitable for that. And in chronic pathology, you see, in chronic pathology, huge infiltrations will be there, dominant granulations will be there, thickened fibrosis will be there, hyperkeratosis and acanthosis will be there. And if these patients, it is very, very difficult to eliminate these hard accumulations inside the body. So we have to activate the circulation, smoothen the granulations, and fibrinolysis should be there, keratolysis should be there, the waste should be let out, and the healing should be promoted. So for that we are giving internally, Snehapana is very essential. Snehapana is very essential to smoothen the granulations. You see, in chronic cases, that is why in Kushtaroga Prerna, there is a reference that Kushtanam Snehapanena Purvam Samyaguvajayade. Snehapana is highly essential to smoothen or soothen the granulations inside the body. In chronic cases, the granulations will be there, So in order to smoothen the granulations, we have to give Snehavana. Before that, we have to give Pajana and Devana drug. Pajane, Devane, Snehistan, Swedaischa Parishkritan, Shodhayed, Shodhane Kale. That is the line of treatment detailed in our classes. Wiping out should be done by the heat application, Avagaha, Dhara, Taila, Krita, Pindasweda, Charakarma, Rektamoksha. These are all the topical therapies that can be used in case of Ayurvedic dermatology cases. Various drugs we can change according to the patients, and the treatment modality, treatment style, all these we can change according to that. These are all the Rektamoksha techniques we are practicing in skin cases. And diet also is very relevant. I am concluding within 1 hour. After that, we can you can ask some queries regarding the Ayurveda dermatology practices, and the answers. If I know, I will try to answer. You see, in diet also you see very relevant in Ayurveda dermatology. If these factors, the dietetic factors, if you are not considering, the chances of triggering, that chance of aggravation is there. So proper bio enhancers means that if the food items should be properly digesting and helping to digest. The Pajana and Devana, Aushadas or Aharas are very essential to deal these cases. While we are giving a Pajana Aushada or Sramsan Aushada or a Devan Aushada, if we are not insisting the patient to take Pathya, then the patient will take the food items that hampers or that hinders the absorption of the proper food items, and that will hinder the absorption of these medicines also. So during the time when we are giving anulomana drug, we have to give the anulomana aharas also. Anulomana aharas like the manda, peya, vilebi, like that. We have to modify the food items according to that. And we have to give the bio-enhancing Pajana and Devana aharas. To modify the aharas, we can add the Pajana and Devana these materials along with the food items. And for the functional and structural aspects of skin, carbohydrates, proteins, fatty acids, vitamins, minerals, flavonoids, probiotics. These are all essential factors for the structural and functional aspects of skin. So along with the diet, we have to give supplements like these factors. So let me conclude this session with this. And for each and every slide, if we are describing in detail, there are so many factors to detail. So